Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, and I am excited today to continue our walk through the Blue Book. And I'm going to be talking about delegation. So if you have the Blue Book, we're going to be on pages 8 and 9 of the Blue Book. And delegation is different from assignment. If you have the Blue Book, you can see that assign is across, there's no T on the end of that word. Delegation is down. So you assign, ASSIGN, across, ACROSS, and you delegate down. So assign means you assign it to another RN. So you assign a patient. You don't assign a task. You assign a patient to another RN. So let's talk about delegation. You delegate down. So you delegate a task to a UPA or an LPN. So you delegate a task to a UAP or an LPN. And you have to remember that you're delegating tasks. Okay, you're delegating tasks. That's the key word here. And so the most important thing is to determine if it's a task that they're allowed to do. So what is the UAP allowed to do? The UAP is allowed to do activities of daily living. So activities of daily living are things like dressing them, they're getting dressed, washing, may say bathing, ambulating, it may say walking, moving in bed, brushing their teeth, feeding them, anything related to getting them food or feeding them. And then they can measure things. So they can measure vital signs, they can measure weight, they can measure intake and output. What they cannot do is they cannot evaluate anything and they cannot monitor anything. So those are two key words to remember not to use. Don't pick an answer that has the word monitor, evaluate, or for that matter, if it has the word assess in it. Those words are out for the UAP. Okay. Now, they cannot teach anything, but what I have noticed in questions when I do questions is they can remind patients to do ADLs. They can't remind a patient to do coughing and deep breathing because that's an RN or LVN activity. They cannot remind a patient about any teaching about their disease process. They can't do that, but they can remind patients about an ADL. So they can remind a patient to brush their teeth. They can remind a patient to stand up slowly after the RN has taught them about needing to stand up slowly after starting on a new blood pressure med, for example. And they can transport stable patients. So the patient has to be stable. They cannot transport unstable patients, but they can transport stable patients. Now, as far as delegating to an LVN or an LPN, they can delegate anything except no IV of any kind, no blood transfusions of any kind. I would not delegate any assessment. I have found in doing questions that even assessing skin turgor is not, you don't do that. So according to the National Council of State Boards of Nursing, there's a kind of a hierarchy of activities that nurses do. And at the top of the hierarchy is teaching, care planning, and assessing. And so I never delegate teaching, care planning, or assessing in any way to anybody else. I do all of that. But what the LVN can do is they can monitor and they can evaluate. They can do focused assessments. They cannot do a complete head to toe assessment or comprehensive assessment, which means they can't do an admission assessment or a discharge assessment because comprehensive complete head to toe assessments are done on admission and discharge. So they can't do any of those things. I just want to make sure I'm covering everything. Oh, LPNs can reinforce or review teaching. Sometimes it'll say remind. So they can remind them. You cannot delegate to them to evaluate a patient who's unstable. So they can evaluate something, they can monitor something, but not an unstable patient. So if the patient is unstable in any way, like has a changing assessment or a new like a new onset, like they just started to complain of chest pain or something like that, don't send the LVN in to do that. You cannot delegate hanging or mixing IV meds. If you're wondering what I'm looking at the Blue Book over here. I just want to make sure I'm covering everything that's here. So it says, what can the RN delegate? They can delegate direct patient care. They can evaluate and they can evaluate and monitor the patient, and they can do non-IV medications of a stable patient. So they can do PO meds, they can do IM meds, they can do sub-Q meds. They can't do any IV meds. Okay, so that is what you can delegate. You can always get the blue book, and you can have all those things in writing if that's what you want to do. And I do recommend it. You can get it on Amazon, and I don't make any money off of that. So I'm not advertising something for me. So
hello, Clinic Review family. As you probably know, this YouTube channel is part of a bigger Clinic Review organization, and we sell NCLEX reviews online on demand, as well as do live in-person reviews. We also do tutoring, and you can learn more about that at clinicreviews.com. But we also do streaming. And so I just want to talk with you just quickly about the streaming that we offer. If you go to courses.clinicreviews.com /pages/clinic-streaming, and I will put this in the description, you can find out more about our streaming. You can start your free trial, or you can go ahead and join it for $19. And all videos are included in our 3-day trial. So what this is this is actually you get an introduction to the Clinic Review itself, but you actually get all of our YouTube videos with no commercials. So if you go over here, you can actually like pick me. You can say, oh, I want all of Dr. Sharon's videos, and you can see that all of the videos that are on YouTube are also here. So you can access all these things. So if you're like, I'm not a big fan of YouTube, or I really want everything with no commercials, then you can go ahead and sign up for our streaming. And so if you sign in, I'm signed in here. So here we go. All right. So that takes me to Clinic streaming, and then I can scroll through and watch the videos. So if I go back to my dashboard, this is actually where I can then access. I can also do tutoring, May tutoring. I can do the on-demand course as well. So this is sort of our dashboard is sort of provides you with anything you pay for that you get there. Okay. So, and don't tell anyone, shh, this is a big secret. Shh, don't tell anybody. But I may sometimes put videos up on streaming that I don't put on YouTube. Okay. So that's a big secret though. Don't tell anybody. So I hope you have a great rest of your day. Thanks for being a part of our family.
let's go ahead and do some questions now. We're going to just do, I think 6 questions is what I have here. And we're going to be doing delegation. In the care of clients with pain and discomfort, which task is most appropriate to delegate to the UAP? So we're delegating a task. So you say, what are they allowed to do? They're allowed to do ADLs, and they're allowed to measure things. Okay. So I'm going to pick an answer that has that. Assist the client with prep of a sitz bath. Well, that's ADLs. Sitz baths or ADLs. There's no medication in a sitz bath or anything. You can assist them. All right. B, monitor the client for signs of discomfort while ambulating. They don't monitor, evaluate, or assess anything. C, coach the client to deep breathe during painful procedures. That is an LVN or an RN activity. They don't do that. And then D, evaluate. See, they don't monitor or evaluate anything. So the fact that it has monitor and evaluate, in those words, I cross them off immediately. And then A and C, if I were to decide between those, I'd say which is more of an ADL, and the one that's an ADL is A, because coaching them to deep breathe during a painful procedure would be the RN would do that, or maybe the LVN if they'd already been taught about it. But all right, number 2, a client has severe pain and bladder distension related to urinary retention and possible obstruction. An experienced UAP states that she received training in indwelling catheter insertion at a previous job. What task can be delegated to this UAP? So you cannot delegate anything except for what they're trained in, and they have to be trained and checked off by your institution. So it would have to say she had been confirmed. Her ability to do this would have had to be confirmed by your institution. It's not the RN's job to confirm that they're capable of doing something. So it's great that she was trained somewhere else. I'm sure they have an education department at your hospital that can confirm that, but that's not something you can do. So I can't let her do the indwelling catheter because of that. So A, assess the bladder distension. I'm not picking anything that has assess. B, insert the indwelling catheter after verifying her knowledge of sterile technique. See, we don't check people off at the bedside. We don't check the UAPs off. That would be the education department or however they do that at that institution. We're not doing it at the bedside. C, evaluate the relief of pain and bladder distension. UAPs don't monitor, evaluate, or assess. D, my dog's squeaking her toy. D, measure the urine output after the catheter is inserted and obtain a specimen. I told you they can measure things. Remember that? They can measure things. So that is what we're going to pick. And if you go, well, I didn't know about B. Okay, you know that D is something they can do. You know D is something you can do. So if you have it between B and D and you're not sure, pick the one you know they can do, y'all. And D, you know they can do. So even if you weren't sure about B, D would have been the better answer. And you could have still gotten it right if you were using proper testing strategies. 3, the nurse is caring for a patient with esophageal cancer. Which task could be delegated to the UAP? A, assist the patient with oral hygiene. Yes, that's an ADL. B, observe the patient's response to feedings. So I said they can't evaluate or monitor or assess, and observing their response is the same as evaluation. So they can't do that. C, facilitating expression of grief or anxiety. No, they don't. That's not an ADL. D, initiating daily weight. So they can measure weight, but they can't initiate it because that's care planning. Anything that's initiated is initiated by the RN. So the question here might be, well, they have esophageal cancer. Yes, they do. And the question is, what are they allowed to do, period, delegation wise? So what tasks are they allowed to do? And they are allowed to do oral hygiene. So that's what we're going to delegate to them. So unless they tell me they have a specific reason why I cannot delegate this to the UAP, and a diagnosis of esophageal cancer is not enough to say they cannot do it, then I'm still going to delegate that to them. 4, the nurse is working in a hospice facility for patients with AIDS. The facility is staffed with LPNs and UAPs. Which action will the nurse assign to the LPN? So I find that when they give me a question that includes a team of people, an RN, LVN, and a UAP, I find that there's usually in the answers, there's going to be at least one that would go to the RN, at least one that would go to the LVN, and at least one that would go to the UAP. So what I have to say is, well, which ones would go to who? And then the question is saying, what are you going to delegate to the LPN? And it doesn't say delegate here. So y'all, you need to understand when it says which action, it's a delegation question. Even though it has the word assign, it shouldn't say that. It should say delegate. Okay. So A, assessing patients' nutritional needs and individualizing diet plans to improve nutrition. That's what the RN does that. B, collecting data about the patient's responses to medications used for pain and anorexia. Well, they certainly can collect data. The LVN would be able to do that. C, develop UAP training programs about how to lower the risk for spreading infections. That's a teaching activity, care planning teaching activity. So no, the RN has to do that. D, assisting patients with personal hygiene and other activities of daily living as needed. That's the UAP. So A and C are RN, D is UAP. So the only one that I would delegate to the LVN would be B. And in this case, you might go, well, I wasn't sure about B, but you know A and C are RN and you know D is UAP. So it's the only one left that makes any sense. 5, a registered nurse is planning care for a group of clients on a med-surg unit. Which task is most appropriate for the RN to delegate to the LVN? Okay, so LVN delegation. Develop a care plan for a client with congestive heart failure. No. Assessing, care planning, and teaching, I don't delegate to anybody else. So A is out. B, perform a focused assessment. That's okay on a client who's complaining of chest pain. So that's not okay. They can perform a focused assessment, but it looks like they're having a new symptom. And so I don't tell the LVN to go in and do a focused assessment on a new symptom. C, administer oral medications to a client with hypertension. Absolutely, they can do that. D, educate a client with diabetes about insulin. No, teaching, care planning, and assessing are out. And since B is on a patient with a new symptom, I can't do B. So C is going to have to be what I would delegate to the LVN. 6, an RN on a surgical unit is assigning tasks to the LVN. Which of the following tasks is appropriate to delegate? A, performing trach care and suctioning. Yes, I can delegate tasks. I don't delegate teaching, care planning, or assessing, but I can delegate PO meds. I can delegate tasks. I can delegate treatments like dressing changes and so forth. So A is yes, I can do that. B, assessing the client's pain level. No, I don't delegate assessing of anything to the LVN. C, monitoring a client who's receiving a blood transfusion. So they can monitor, But because it says blood transfusion, I'm crossing it off the list because they can't monitor IVs or blood transfusions, and they can't monitor any IV stuff. See, creating a care plan. No, I don't delegate teaching, care planning, or assessing. So the only one here that I can delegate is performing trait care. And don't say, well, that's a complicated procedure. It's a skill, y'all. It's a skill. And there's, other than starting an IV or doing IV stuff, they can do any skill. And they can do IVs if they're given special training for that. And it would have to say they've been giving special training. Otherwise, I can't delegate it. All right. I hope that was helpful to you. You will get delegation questions on the NCLEX. You need to know the difference between assigning and delegating. So make sure you understand the difference. And I do recommend getting the blue book. I hope you have a great rest of your week or weekend or whatever day it is for you. Have a great day. Thanks for being part of our family.